Welcome to our CPR course. In this video, we'll guide you through the essential steps to perform CPR effectively. Let's get started. Before you begin CPR, it's crucial to assess the situation. Make sure the environment is safe for both you and the patient. Check if the person is responsive by gently tapping their shoulders and asking, "Are you okay?" If there's no response, it's time to take action. If the person is unresponsive, call for help immediately. Dial emergency services and provide them with all necessary information, including the location and the condition of the patient. If possible, ask someone nearby to call while you begin CPR. All right, now let's move on to performing chest compressions. First, place the heel of one hand on the center of the person's chest, right between the nipples. Then, place your other hand on top of the first hand. Interlock your fingers and make sure your elbows are straight. Now, using your body weight, press down hard and fast, at least 2 inches deep. Aim for a rate of 100 to 120 compressions per minute. Remember, the key here is consistency and depth. Keep going until help arrives or the person starts to show signs of life. After 30 chest compressions, it's time to give rescue breaths. First, tilt the person's head back slightly to open the airway. Pinch their nose shut, take a normal breath, and then make a complete seal over their mouth with yours. Give 2 breaths, each lasting about 1 second, and watch for the chest to rise. If the chest doesn't rise, retilt the head and try again. Then return to chest compressions. Remember, the cycle is 30 compressions followed by 2 breaths. Continue this cycle until professional help arrives or the person starts breathing on their own. Now let's talk about using an AED or automated external defibrillator. First, turn on the AED and follow the voice prompts. Expose the person's chest and attach the AED pads as shown in the diagrams on the device. Make sure no one is touching the person, and then press the Analyze button. The AED will check the heart rhythm and advise if a shock is needed. If a shock is advised, clear the area and press the shock button. After the shock, immediately resume CPR, starting with chest compressions. Continue to follow the AED prompts until emergency services take over. Great job! Let's quickly recap what we've learned. First, check the scene for safety and assess the person's responsiveness. Call for emergency help and start CPR with chest compressions. Remember, 30 compressions followed by 2 rescue breaths. If an AED is available, use it as soon as possible and follow the device's prompts. Consistency and proper technique are crucial. Thank you for joining us today, and remember, your quick actions can save lives. Stay calm, stay focused, and be ready to act in an emergency.